There is a one-to-one correlation between someone's wealth or their ability to care for themselves and pay for what they need and their long-term well-being, at least up to a certain amount of income. And so the more that we can help people exit outside of the cycles of poverty and or mitigate the poverty's impacts in someone's lives, we're investing into their well-being and their long-term health.
Welcome to the Faces of Riverside 2026 magazine and our interview series where we get to talk to the folks that we've highlighted in the magazine, where we get a chance to dig a little deeper into not only them as individuals, but the organizations that they run and to learn a little bit more about the good works and efforts that they're undertaking. That being said, super excited today. We have with us the executive director of Parkview Legacy Foundation, Damien O'Farrell, and Sherry Chun, the external affairs and grants manager. Damien, Sherry, welcome.
Thanks, Norm. Thank you for having us.
Wonderful to be here, Norm.
Great, my pleasure. So I wanted to kind of start at the beginning. I have a series of questions and thoughts that I kind of want to delve into, but let's start with a little bit about who you are as individuals. So, for folks that may not know you yet personally, can you briefly introduce yourself and share a bit about what brought you to Parkview Legacy Foundation? Damien, can we start with you?
Absolutely. So Damien O'Farrell, President CEO of Parkview Legacy Foundation, and lifelong Riverside resident. And what brought me to Parkview Legacy Foundation was that really in my previous role, leading a nonprofit that is a homeless service provider, I found myself at the kind of the back end of a process that people found themselves in which they'd already been deeply impacted by a lot of different things in their lives, some of which were in their control and a lot of things that were outside of their control that impacted them, and always felt a desire to be able to get upstream and to get in front of some of those impacts so that less people would find themselves in those situations. Or if they did find themselves in those situations, they would be able to more adequately get themselves out into a stable place and a thriving place in their life. And when I'd heard about the hospital in Riverside selling and creating a new nonprofit, it seemed to be an opportunity to do that very thing, make those upstream investments and create change that our entire community needed.
Excellent. Sherry?
My name is Sherry Chun. I have been in Riverside since 1999. I relocated here from Hawaii. My career background is as a registered nurse, and I had the opportunity to volunteer with the old Parkview Community Hospital Foundation and really appreciated the work that they did as it related to, supporting the hospital and healthcare. And when it converted to Parkview Legacy Foundation, was very happy to see that whole health accessibility was still one of their focus areas. And it is very, close to my heart as a nurse as well. And so when Damien asked me to be a part of the foundation, initially as an assistant, the opportunity happily, and for the last year have been the external affairs and grants program manager. And so I'm just pleased every day to be able to be involved in this organization that does so much good in conjunction with other local nonprofits.
Great. So, David, if you can clarify something for me,
Sure.
something that you've already mentioned, and Sherry mentioned as well, in terms of Parkview Legacy Foundation, it used to be under a different name or slightly different name, and it was associated with Parkview Hospital. So, can
Sure.
you give me a brief description of what Parkview Legacy Foundation is today and what those roots or what those origins mean?
Sure, sure. So the prior existence of this organization, or the organization that preceded ours, I should say, was Parkview Community Hospital Foundation. And that foundation was established exclusively to support the operations of the hospital, make sure that it had the equipment that it needed, make sure that it had sustainable operations. Nonprofit hospitals often operate with that model. However, when a nonprofit hospital sells to for-profit operators, which happened in 2019 with Parkview Community Hospital, sold to HMC, a conglomerate that owns several different hospitals, the assets that take place in that sale or that belong to that hospital can't go now to the private owners, right, to their benefit. Those assets need to remain in benefit to the community that nonprofit hospital was sold. Often, as was the case for us, those assets are placed into the stewardship of a nonprofit public benefit corporation and then used accordingly to serve the community in which the previous hospital served. So the hospital sold, the previous foundation shut down, and then we started under the direction of our board of directors, Parkview Legacy Foundation. And that's when I was brought on to help that process happen, both the closure of the previous and the start of the new. And when we started, we had a very broad kind of charge, which is to address social determinants of health, right? All the things that affect somebody's life and well-being before they interact with the healthcare system, right? Before they have to go to the hospital, before they get sick. And that's a lot of things. And we had to decide what to focus on. What did our community really need? And we landed on four things, which is housing stability, social mobility, which is anti-poverty issues, what we call whole health accessibility that involves both of those things and needing to have stable housing and have enough funds and the wherewithal to invest proactively in our health, as well as access to healthcare. And then integrated solutions, which is what we can all do together. So to accomplish things in our communities that we can't accomplish working alone in silos. And so that's where we are now focused and issuing grants and doing work in each of those four focus areas, all in support of our community's well-being.
Okay, so can you perhaps go a little bit deeper in terms of why those areas in particular are so important to the overall health of the community?
Yeah, so the reason that we landed on those as being our four focus areas is because they seem to have one, a tremendously catalytic impact on one's well-being. So, for example, there are plenty of studies that demonstrate that if somebody has not only adequate housing but stable housing, the likelihood of them having healthier lives, longer, healthier lives, is dramatically improved as opposed to if you're constantly in disstable housing, constantly under that stress, or if you find yourself out, in a house situation. The likelihood of not only disease, but just immediate infirmity goes way up, and you have less enough of an opportunity to address your healthcare concerns in those unstable situations. And we are in a housing crisis in our region, in our state, in our nation increasingly, where we simply don't have enough housing to meet the level of need for people at every level of income. The housing that we do have that is accessible is way too expensive, so people are spending way too much of the income that they do have on their housing just to keep a roof over their head. So it puts a lot of people in very, very stressful and tenuous situations that are often threatening to their well-being and their lives. And so we need to get ahead of this, need to address these issues. And we could address any number of issues related to healthcare or disease. But if people don't have a stable place to live, all that's like working on quicksand, right? So we have to create a more stable environment for us to live and for our children and our grandchildren to live. So that's housing stability. The other, so social mobility or the anti-poverty work that we do is simply because there is a one-to-one correlation between someone's wealth or their ability to care for themselves and pay for what they need and their long-term well-being, at least up to a certain amount of income. And so the more that we can help people exit outside of the cycles of poverty and or mitigate the poverty's impacts in someone's lives, we're investing into their well-being and their long-term health. Whole health accessibility, as I mentioned, it does depend upon those two, right? So to be able to have whole and healthy lives, we need stable places to live and we need enough to invest proactively into our well-being. But also it involves access to healthcare and access to what we might call culturally appropriate or culturally responsive healthcare. And in both of those cases, our region is negatively impacted because we don't have enough doctors per 1,000 households or 1,000 individuals, we have less healthcare and less healthcare providers than what we need to adequately serve our community. And often, cultural divides, whether it be backgrounds or ethnicities or language, but then also the impacts of poverty can often get in the way of people's ability to get the care they need in the way that they need it, so that they can implement that care in their life. So there's a lot of kind of cross-cultural development that we need to do so that if people do get sick, they have the care that they need, but also so that they can invest in well care, not just sick care. The last saying is integrated solutions, which is all these things are related to our health and well-being, but they're not maybe directly so. They're indirectly, as I've mentioned, related to our health and well-being, but they often are being addressed in sectors outside of the healthcare sector. And what we know now more than ever is that continuing to work each sector alone, trying to solve its own problems that just involve its sector, it actually doesn't work, right? We're all interrelated, and we need to be able to figure out ways to collaborate and integrate our work in a way that actually moves the needle and doesn't just address issues or address problems, but solves the problem and solves the root causes of those problems.
Well, so those are four key areas of focus. And it sounds like for someone who's listening to this and just learning about Parkview Legacy Foundation, that we must have an enormous staff on board to accomplish all of these individual or each one of those four key areas of focus. But that's not really how Parkview Legacy Foundation works. If I understand it correctly, the foundation partners with local organizations, and I'm wondering if Sherry, if you can talk a little bit about what those organizations, who they are, and how does it help from in terms of creating a broader impact across the region by working with them, as opposed to internalizing all of this and building internal structures to support all of these things, because there's a lot of heavy lifting in each one of those areas.
Exactly, Norm. We have a tremendous amount of organizations that do wonderful work in our community. And Parkview Legacy Foundation, we're not there to replicate their work. We're there to network with them, to help collaborate between different types of sectors and networks to build, like Damien mentioned, those integrated solutions. And so Damien and I do a lot of outreach. We belong to a lot of different organizations and networks within the community where we can meet with and work with and really look at the system because, as Damien mentioned, the human is a system and what it needs, and so is this network of organizations. And so we try to not piecemeal care, like, okay, this one sector is going to take care of housing and then this one whole health. But as Damien mentioned, it's all related, it's all dependent upon each other. And so we do a lot of network building. And one of the things that I have been spending, the last 6 months with Damien on is to actually meet with all of our applicant organizations and look at where they fit in this puzzle that we have and we're trying to build. And so that we can work together so that there's no duplication of services. But if an organization takes care of housing, they can also look at the individual as a whole and determine maybe, okay, we're going to help you with housing, but I also see that you don't have health insurance and you have some chronic health issues that we want to help you take care of as well. And so we always talk about a no wrong door philosophy, where when someone comes to one of the organizations, we're all interrelated and we can refer warmly by assisting that person to get help from another organization for another need. And so our big goal at Parkview Legacy Foundation is to help create this network so that all of the needs are met. And that's the only way really we're going to help people to actually thrive in their lives and get out of poverty.
So creating a network, creating a network really obviously involves understanding who the potential partners are in that regard. You mentioned something, Sherry, about applicants. Um, can can you? I'm still trying to get a really firm grasp of how Parkview Legacy Foundation is impacting or working with these other organizations? Is Parkview offering consulting or advice or money? Talk to me about what the term applicants kind of meant
I will.
and how that applies to the different organizations.
Definitely. So, in the first 5 years of Parkview Legacy Foundation after the transition from the previous nonprofit, there was a lot of network building and a lot of foundation building within Parkview Legacy Foundation itself. But last year in 2025, Parkview Legacy Foundation was fully funded, and we were able to offer our Impact Grants program. And so this past January, we were able to invest $1.2 million into organizations that serve our region in our service area that are doing this excellent work towards housing stability, whole health accessibility, social mobility with integrated solutions. When I mentioned awardee, those are the people that have received, we had 13 organizations that were able to receive funding through our Impact Grants program. But we also had 53 total organizations apply for the grant. And so on top of the networks that we were already a part of and working with, we had, 53 organizations that now can also come under the umbrella of networks that we work with and try to make sure that they all have a place in the system of assisting our residents here in Riverside.
So, Damien, how do you identify what is an organization that you feel like the investment of not only money, but certainly resources and time? How do you identify which are the right types of organizations? And then how do you select those that you have ultimately, in this case, Sherry, you said it was $1.2 million this year. How do you select those that receive the funds?
So that happens through a multi-layered process, right? So essentially, it starts off with the application, but an organization to receive funding from Parkview Legacy Foundation has to meet three key criteria. One, they have to be a nonprofit. They have to be operating in our service area because the Attorney General set our service area of where we can invest our funds, which is roughly in the Riverside region, but it's defined by zip codes. So an organization has to be serving individuals or serving the communities within those zip codes. And the third thing is that they have to be trying to advance work and solutions within one of our four focus areas, right? So housing stability, social mobility, whole health accessibility, or integrated solutions. If an organization meets those criteria, then they are a good fit to receive funding from our organization. However, in this last round, we received 3 times the amount of funding requests than we had money to give out. And so we weren't able to fund everybody, and we had to do a vetting process to identify just what you're asking. What can be the most catalytic use of our funds? Or where can we invest our funds that will have the most catalytic impact, not only for the organizations that receive the funding, but for the entire community at large, and even maybe other organizations as a result of their work. And so we looked at the impact that the amount of money that we would have to give to any organization would have for that organization. Would it be a shot in the arm? Would it help them expand services? Would it help them turn the corner? Would it help them create, as in many of the cases, new sources of sustainable funding to carry on and to expand their work? And so the organizations for whom it seems like what we have to give is going to make the biggest difference, they tended to rise to the top. Or organizations that, as again, I mentioned, that seem like their goals, their objectives, what they would be able to accomplish because of this funding would have those larger impacts within the community for more people, and not just the people they serve, but again, the community at large. And sometimes that's a lot of qualitative, not quantitative decision making, but we don't take it lightly. We really take a look at the organizations and do a lot of evaluating to make those decisions, starting at the staff level, but then also at the committee level and at the entire board level, because the board ultimately are the stewards of these fundings, and they make the ultimate decision.
So it sounds like there's a lot of analysis involved in looking at these organizations one by one. And those, if I understand what you said correctly, those that rose to the top in terms of having an opportunity to have a fairly significant impact in their area of focus. And so they're then funded. That being said, so is Parkview just about identifying good organizations and providing them with money to help them carry out their own activities, or is there more to it than that?
Yeah, there's a lot more to it than that, actually. And that's one of the reasons why we are following up with every applicant, including those that didn't get funded, because first and foremost, every applicant organization that applied for funding deserved the funding that they were asking for. There's really a lot of fantastic work that's taking place in our region by really well positioned and strong nonprofit organizations. Where there is room for us all to grow is how we work together, right? How do we collaborate and integrate our efforts towards long-term solutions? And we are in a position, not providing direct services. Often I refer to it like a balcony. We're up on the balcony being able to see a lot of the work being done and being able to see connections that can be made and ways that we can improve on our efficiencies or take advantage of unlikely partnerships, are in the process of not only following up with the applicants to share with them what we heard and what we saw in our appreciation, but to discover those ways that we can work together more effectively to really move the needle. And there's a lot of work that goes into that process of making those connections, building those networks, building what we call the civic infrastructure, or supporting the building of the civic infrastructure that allows us all to work together in innovative ways or in new ways that solve problems that we haven't been able to solve up to this point working independently. So that's where, between grant cycles, one of the things that we feel really is not only our honor and our pleasure, but it's our responsibility to contribute to our community as well.
Okay, so can we look at this from a real world standpoint for a second? I understand all that you've just described. Can you give me an example of a project or a partnership the foundation supported that kind of demonstrates or illustrates the kind of change you're working towards?
Absolutely. Sherry, do you have one that comes to mind that you'd like to share?
We actually do. We have a lot of, well, I'll start by saying we had three different types of grants we gave. One was a collective impact grant, and that involved networks of networks that are working together to really move the needle in one area or another. And one of the organizations is Growing Inland Achievement. And they look at education, basically from birth all the way up in trying on that social mobility piece to help move families and individuals along to actually, end up helping. They might be the first generation college student that's going to help move one step, out of poverty. So those organizations, for example, they don't only rely on partnering with nonprofit organizations. They part with corporate businesses, they work with cities and municipalities, they work with the educational systems, from the unified school districts all the way up through the colleges, and trying to build this like microcosm where you can truly have a straight path for individuals to learn. And so with the collective impact grant, we're seeing that as being, one of the most transformative groups and networks to actually help, not only meet the immediate needs and that are vital, right? We know that those daily needs must be taken care of for people, and we absolutely value and respect it. But with Parkview Legacy Foundation, we're looking for that transformational long term work. So our investment into these collective impact networks will help us, to really see the impact in lives and in families as we move along. The second impact grant that we gave was called the Core Operations and Capacity Grant. And that was to allow just any nonprofit organization to gain assistance with whatever their organization needed at the time. And so one of the groups that we have awarded is Family Services Association. And they're an organization that actually works, with the whole family. They have childcare education, they have nutrition services, they have healthcare services, really expanding their mental health and behavioral health services that they provide, but also have huge networks to help families with workforce development or other things that they need. And so, really taking care of the children while also helping the parents move the family out of poverty. So, that's just one example of one of the core operations grantees that we had, but that's the type of work that we at Parkview Legacy Foundation is trying to support financially through our grants. But as Damien says, when we meet with all of the applicants, even the ones that have not received award, there is a lot that Damien and the foundation can assist individuals with, or I should say assist organizations with. We have huge resources and huge networks that we can connect people with someone that can help their organization really make a change that they need or fill in a gap somewhere. So, both financially and also just with partnership, that's how we're really trying to look at our local nonprofit environment and be of assistance to everyone.
So the organizations that you're supporting financially, that you have gone through painstaking efforts to identify, and to look at their what they're trying to accomplish or what areas of focus that they're working on. How do those investments translate into real improvements in people's lives? Is there an
It really
example of that?
Sure. I mean, so there's a lot of examples of that, and it really depends upon the types of the specific organization that's been funded. So in some cases, we're working with direct service providers. For example, one of the organizations that provides free or very, very low cost dental services to individuals who otherwise wouldn't get those dental services, and not just cleanings and things like that, but serious works, like surgeries and the creation of dentures and things like that for individuals. And so every individual that is utilizing those services not only needs it, but has a, you know, life changing in some ways impact because of the health concern that's being addressed. Other organizations, as Sherry had mentioned, are giving other sorts of direct services like child care that then allows a family, or low cost child care that then allows a family to get the work that they need to provide for their family that can serve their family not only now but for generations. Other organizations are providing housing to individuals, right? So or working on building new forms of housing that will make more housing available to greater numbers of people at various income levels. So the individuals being served by those organizations that we're working with are the ones that are really having the impact. But then again, too, at the community level, we're looking at what sorts of changes can be made to make it more likely than not that individuals can create better lives for themselves. As an example of that, we're working with a number of different organizations through what's called the Vital Conditions Network, where we're looking at how can we across the community make sure that every one of what has been identified as 7 vital conditions, and somebody can go and look this up so I don't have to go into the detail of it, but they can go to
Sure.
ieconditions.org and see what these 7 vital conditions are that need to be at certain levels of accessibility or availability for our community to really thrive. And how can we work together to support one another's efforts in doing that? So then not only our individuals, but the community at large is impacted. Does that answer your question?
So I wonder, it does. So, but it leads to another. And that is in terms of success. What does success look like for the people that you're trying to help? And that might be at Parkview Legacy Foundation's level, might be organizations that you're trying to help, who in turn are helping individuals. So, what does success look like? Because you have, again, identified these organizations that are doing good work, that have a compelling or a pressing need for financial resources to help them advance their own efforts and to help more people. Once the proverbial grant is given, how do you measure success? How do you know at what you've chosen or selected in terms of the organization and the programs they're offering are actually working?
Yeah. So a number of different levels for this. One is the are the organizations that we are walking alongside, able to do more of what they're doing, right? And able to accomplish their goals or and move towards their objectives, which are often long-term objectives that is going to take longer than 1, 5, even sometimes 10 years for them to accomplish. But is there some sort of measurable evidence that they are able to move closer towards meeting those objectives because of whatever support that we are able to provide? That is success for us if they're able to do that. The other is whether or not we seem to be, this is the more long-term success for us, which is, do we seem to be moving more towards a world or a community in which it is more likely than not that somebody can have to build the life that they want for themselves and have those thriving lives. Right now, it's possible, at least theoretically, for anybody to be able to build that life, but it's not very likely for some of the individuals in our community. And we want it to be as likely for every individual as it is for any other individual to be able to do that.
Is there, Sherry, is there a, when you talk about applicants, so these organizations are in one way, shape, or form, they learn about Parkview Legacy Foundation. And you mentioned that you had this year given $1.2 million. Is there a time frame in which those dollars or those applicants, let's start there, in which those applicants can apply, or is it available at any time? Can you talk to me a little bit about that?
So, with two of the grants that I spoke of, the Collective Impact Grant and the Core Operations and Capacity Grant, we offer those once a year. So, applications are open at any time through our portal, and we actually will close applications this year at the end of August for those two grants. And then we go through that rigorous decision making process. And by the end of November, early December, we inform the organizations who will be funded and awarded for that year. And then the funds will be given to them for January of 2027. We have a third grant that is called the Emergent Needs Grant. And what that one is, it's a little more flexible grant. It is a revolving grant that is available all year long. Organizations may go to our portal to apply for that. And usually we'll hear within 30 to 60 days whether they'll be funded for that grant. And the purpose of that grant is for those unexpected needs that come up during the year that an organization may not have budgeted for. For example, if, in your food access program, your refrigerator or cooling system goes out, or if there is a cash flow problem, or let's say you might need some new software to help do some type of a coordinated care, or some type of licensing comes up for your staff that you didn't expect that you need to take care of. This is a really responsive fund that someone can apply for and learn within 60 days, whether they'll be accepted to get those funds. To really look at the needs of organizations. And for the first two, obviously, when we're budgeting on an annual basis, those funds are very important. But then also wanted to take care of those needs that come up that can really cause disruption, right, to the services provided by organizations if one important element is not available. So for this coming year, we welcome people in our zip code region to visit our website or, our portal and take an eligibility quiz to see if they are eligible for any of those programs that I mentioned. And and we're very responsive. We turn over, their eligibility and letters of intent very quickly so that they know whether it's a probability that they could be awarded a fund from any of those three grant funds.
So, if I understood you correctly, if I'm remembering correctly, you said there were 13 organizations that received funds this year. Is that correct?
That's correct. We gave 3 of the collective impact grants, and we gave 10 of the core operations and capacity grants. And so far, we've given 1 of the emergent needs grants.
So you mentioned $1.2 million. And I'm wondering, in addition to determining the works of any particular organization and the programs or the needs that they may have, Is that money equally distributed amongst them? If I came to you next year, as for Norm's Foundation, which I just created for the sake of this question, and could I apply for $1.2 million? Or is there some way of determining, or are there limits that are available on a per grant basis?
This is something that we're learning as an organization as well. This was in our, excuse me, this is our inaugural grant cycle. And so we had to do a little bit of a guesswork, but it's not, it's an educated guess, having been in the industry for over, 20 years and having been on the other side where, we have applied for many grants. We kind of know what's needed in order to help move something forward. And so, as an organization, one of the things that we decided was that we wanted to give grants at amounts that were sizable, at least for us, but is that an organization could really do something with. So a lot of organizations, especially at our size, take a different approach, which is fine, but they choose to distribute to many organizations at smaller amounts. We decided to make the amounts that we gave to each organization that we funded enough for them to actually accomplish what they're trying to accomplish. And we've actually received a lot of appreciation back from the organizations for taking that approach because, having been on the side where you do a lot of work to receive, $5,000, we appreciate the $5,000 from the organization, but there's only so far that $5,000 can spread. So that went into our decision making process. Then obviously the amount that we had to spend, and then we divided it up accordingly. And we had guessed that the collective impact grants would probably be in the amounts of around $100,000 or so each, and that the core operations and capacity building grants would probably be in the dollars or so. That being said, our committee and our board has full discretion as to how much to award each organization, whether they award more than the $50,000, for example, or less, according to what is being asked for and what the organization's need is and what they're trying to accomplish. So, what we ask the organizations to do is tell us your vision. Tell us what it is that you're really wanting to accomplish, and tell us what it is that your real need is right now for funding, so that we might not be able to meet the whole need, but we may find ourselves in a position that we can give kind of more than the average to help you really close the last mile in a need that you're facing right now, or an opportunity that you're trying to seize. And we really try to make it as much of a conversation throughout the application process as possible, even though that can be difficult to do through just the nature of having to submit an application, right? And it being somewhat of a competitive process. But we really try to be as transparent and communicative to our organizations that are applying as we possibly can.
So, so Damien or Sherry, how has the community responded to the the efforts of Parkview Legacy Foundation? Are you hearing feedback from the community as a whole outside of those individual organizations who I assume are excited and have to be working with the organization? Are you getting feedback from other folks?
We are getting feedback a lot, because we chose to spend time to follow up with all of the organizations that did apply. We're getting a tremendous amount of positive feedback. As Damien mentioned, even though organizations did not get funded in this round, they appreciated the approach that we took of larger awards rather than spreading smaller awards because they, like Damien said, as an executive director or president of an organization, you know what you need, and so it was much more beneficial in their eyes also that someone received $50,000 versus everybody across the board $5,000. So we've had that positive feedback. We also have had a tremendous positive feedback on our approach. And as local funders, the amount of interest that we're taking with working with and meeting with all of the organizations. And I think we're very genuine in our desire to help in any way we can, financial and non-financial, and I think it feels like it's coming through, and I think we have the privilege of being able to do that because we serve, a small finite area, and that we can really focus our attention on this smaller, segment of our community, of our region, and so I think they appreciate the amount of attention and the willingness that we have to go further, and As I mentioned, we try to be very responsive to our organizations when they have needs. We email them back very quickly, make connections very quickly. So we are getting a lot of positive feedback in that way. We just distributed money, a few months ago. And so I think as time goes by, we're going to be able to see a little more of the impact and what we're able to do, what the organizations are able to do with those funds. And so we're just eagerly looking forward to that. We have Damien mentioned the IE Vital Conditions Network. There's a big meeting coming up this month that we're trying to get all of our applicants to attend so that we can bring them under that big tent and kind of see how some of our other partners might help these organizations move their missions forward also. So I think we're excited to see in the short amount of time that we've been working with these organizations, how far we have been able to come, and are excited and looking forward to, long-term partnerships. And, we have second, third meetings with some of these organizations coming up. So it's a good feeling. That we see that beyond obviously that financial investment is the investment of time and resources is beneficial to the organizations that we are working with at this time.
If I could add to, so it hasn't been surprising to us, but it's been really encouraging to get the feedback that we're getting in terms of organizations saying never hear from places that we've applied to but have been turned down from. We never know why. It's kind of just a guessing game as to how we might be able to do something different next time or how we came across. So they've really appreciated just the feedback and the ability to have those conversations, as well as the opportunity to think about not only not that what they need to do something differently, but the opportunities to connect with others, to do things in a different way at the community level. There's been a lot of appetite for that and a lot of appreciation expressed to for our willingness to help make those connections, because again, the nonprofits that are working in our community they have so much on their plate and they're working so hard day in and day out. There's often not a chance to take a step back and look at things from different angles. What's on their plate and right in front of them is what has to be done. So we're able to help provide some of that perspective and being able to connect them with others that they wouldn't otherwise connect with, just because of the nature of their work, right, and the heavy loads that they're carrying.
So you mentioned that that your area of service is finite and clearly defined geographically by zip codes, if I remember correctly. Within those zip codes, there are, just guessing, about 300,000 people that call Riverside home. And I imagine that your resources, financial resources in particular, are not unlimited and able to fund for the next 100 years necessarily. So is there an opportunity for that part of the community, for individuals and organizations, to find a way to work with Parkview Legacy Foundation, whether that is providing resources or financial backing, et cetera? Is there an opportunity for folks to play a role in having a meaningful impact on future funding opportunities?
There is absolutely an opportunity to do that, and it's needed. Because we found out very quickly, as we shared before, the amount of need far exceeds the amount of resources that we have or that any of the foundations that we work with on a regular basis have at our disposal. And we really do work closely with the other funding organizations in our region and even at a state and some national levels. And we're constantly trying to figure out how we can grow. For example, we've talked about growing the pie of resources that are available rather than, having to work with the amount that we currently have. Bringing more resources into our region from outside of the area, but also growing the resources that we have at our disposal. Often people want to be generous or they want to step forward and meet a need, and they just don't know how to do it. And even when folks have some financial means, you don't always know what's the best way to use those finances to make the difference that you want to see. Who can we support? How can we do that? And there are collective funds that people can contribute to, and people can also contribute directly to Parkview Legacy Foundation. We are a 501(c)(3) organization. And those donations are, tax deductible to the full extent of what the IRS allows somebody to deduct them and those sorts of things. The bigger part of why investing in an organization like Parkview Legacy Foundation is so valuable is that, one, we're on the ground every day, day in and day out, working with the partners, understanding where the need is, understanding more and more where the catalytic investments that can be made that would, that rises all boats. And we're able to leverage the resources in ways that can't always be leveraged when provided to a single organization with a single focus, though all the organizations obviously need that. Just as an example for that, I'm thinking a few years back where somebody had $15,000 to give. And that's no small amount for an individual to be able to give. But they really wanted that $15,000 to stretch as far as possible, and they decided to entrust Parkview Legacy to do that with some of our housing work. Now, you're not going to build housing with $15,000, right? But we were able to leverage that $15,000 to get an additional $75,000 that then helped support the establishment of the Inland SoCal Housing Collective as a nonprofit that now has over 300 members that are working together to address the housing crisis. And we were able to parlay that work and that energy into helping moving forward some very unique work around the missing middle housing component, where now the city of Riverside is working to standardize and streamline the development of naturally affordable housing available for rent or purchase to a greater number of people than what it currently is available to. And then we're able to use all that, leverage all that work towards the development of a housing roadmap, which will hopefully be distributed here by the end of 2026, that outlines a number of different strategies that can be implemented both locally and at the state level to address our specific housing needs for our region in Riverside and the surrounding area. So that all was seeded by a $15,000 investment, that was able to be leveraged. And that's the sort of work that we can do. In addition to every dollar that we get will go out to the community to support the organizations and support the work that's being done in the community. You had mentioned our team, the size of our team, or you're pretty much looking at it right here, right? The two of us. We do have ECs who's part-time office support and our bookkeeper, and we work with and leverage interns, and we have a Randall Lewis fellow. So we're able to get a lot done with a very small team. But despite, sometimes our board encouraging us to think about making sure that we have the staff we need, that's important, but we've all intentionally stayed as small as possible internally. So every dollar that possible can go out into our community and support the organizations that are doing that important work.
So just a couple more questions. That is very interesting and very exciting, quite frankly. So, Damien, let's just say that I'm an individual and I have $15,000 and I have just discovered Parkview Legacy Foundation today. I watched this interview. I have a general understanding, or rather a basic understanding of what's possible. Where do I go? How do I start? How do I identify what are where my dollars might best be used? How do I understand what you're doing? What's the pathway for me to enter into, and eventually lead to me writing a check for $15,000 to Parkview Legacy Foundation?
Uh, all starts with a conversation, right? So simply reaching out to us, somebody can go to our website, www.parkviewlegacy.org, learn more about what we're doing, what we're up to, what our mission is. And if there's alignment for an individual, they feel like there may be something here, then reach out to info@parkviewlegacy.org. And that will get to us, and we will get back to them to discuss what their passions are, right? Hoping to see what it is that they see as issues impacting their community. And if it's not through Parkview Legacy Foundation that they can help address some of those issues, we will connect them with somebody else who is in line with their passions. Because that's what's really important, right? Is that we're able to move forward the things that we want to move forward, but we can certainly serve as a conduit in that, whether it be directly through our granting program or the work that we're doing alongside that, or connecting them directly with other organizations. I'll add just one other thing too, which is if somebody maybe doesn't have the finances to give, but they have time. We can help connect people with organizations that could use their skills and their passions and their time as well as a volunteer or in serving on their board or using the other assets that are at their disposal. And if somebody is connected with an organization that is doing good work, we always ask those individuals, whether it be they're serving on their board or they're serving as a volunteer, to constantly be asking the question about how we can be doing things in deeper collaboration with others. And how can we, as Sherry mentioned earlier, how can we help meet the whole needs of each person that comes through our door? Not that we're going to be able to meet as a single organization every need, but are we connected enough with other organizations so that there is no, again, wrong door and that whole person every time is being met? And so somebody can reach out to us to help facilitate that process as well, because it's one of the services that we're providing to our community.
Okay, so two more questions. So, in the perfect world, a place that none of us live, but ideally think about on a regular basis, let's flash forward 10 years from now or 15 years from now. Parkview has continued to do the good work that it does. It's been funding organizations over that timeline with the understanding that those dollars are ultimately landing with organizations that are impacting the lives of individuals who really need it here at a local basis. What does the future look like 10 or 15 years from now in the perfect world based on your investment in time and treasure? What does it look like?
Gary, I want to hear
Oh,
your,
okay,
your
I'll
thoughts
go first.
first.
I think for me, I love thinking of that perfect world, but even in that perfect world, people will always have needs. There will always be individuals who will need some assistance through a little hard time in their lives or just have been in poverty and have not made their exit yet. So for me, it's really that integrated community where whether through a child's school or even their participation in something like music lessons that no matter where they go, there are people that are looking out and assessing them for other needs that they can help with. And so a system where we all can really hold people's hands and walk them through and get them to that probability of total wellness that we're talking about. I don't think we'll ever not need nonprofits. I mean, I think that nonprofits will always play a pivotal role in a community's health, but that we all know a little more about each other and where our limits are and what we can help, and then be able to have those relationships with others so that we can make sure we take care of everyone's needs. And in that way, if we have that, then we will have a more thriving community. More people will not be in a place of instability for longer than they need to be. And so I'm looking for that perfect place, and that's what it looks like to me. And so, Damien, how about you?
Yeah, so these questions are always a little difficult because so a perfect world, I'm going to give the perfect world and try to be just a little tiny bit realistic, right? Because I just know how long things take, right? Change takes time. So 15 years is short, but let's say more perfect world, obviously the things that are our four focus areas that we're seeing a dent in those things, a serious dent. So that we are rapidly moving forward new approaches, right? Not just trying to do the same thing over and over again and get different results, but new approaches around innovations in the housing space to make sure we're building enough housing so that housing of various types, so that housing is available and accessible to individuals at every income level, right? So not just affordable subsidized housing for those that need it the most, and not just those that can afford expensive housing that is pretty much the only thing getting built right now, but everything in between as well, and taking a real strategic approach and seeing people be able to stay here, stay housed, and family members not having to move away, children not having to move away from the place they grew up with just to be able to afford the housing that they can access. That would be one thing that that there is. healthcare that is accessible to everybody, and that there is not the discrepancy between the amount of healthcare that is provided in our region as opposed to healthcare that's provided in the coastal cities. Right, we have enough doctors, we have enough all the healthcare professionals that individuals need, and that healthcare is being provided in the ways that people need it to be provided, in ways that they can implement it in their life. Right. In terms of our social mobility, that it is more likely than not, again, for somebody to be able to build generational wealth for their family and mitigate the impacts of generational poverty. And that would be evident in not only a shrinking wealth gap. Right now, we're going in the opposite direction, where even the upper middle class is growing at a faster rate than it has, but it's those that are just fortunate to be on the top of the middle class that are moving up, and then everybody else is actually moving down in terms of their mobility. Opposite direction of what we need. We need to close those gaps. We also need to close those gaps between different populations. So we need to close the wealth gap between different ethnicities. So we need to close the gap even between different genders. It needs to be more likely than not that everybody can thrive. And some of that actually, involves addressing things that we're still experiencing from decisions of our past, right? Where we have individuals or families that didn't get the opportunity to take advantage, for example, of the GI Bill because of, frankly, the color of their skin. So they weren't able to invest in purchasing a home that appreciated at the same level as somebody that didn't get to use that GI Bill, right? So we're seeing generations of impact and an opportunity that have not been available for some, that has been available to others. And it's not to discount that opportunity for others. We want everybody to have that opportunity. But it does mean that we have to do some work to close some of the gaps that we created because of our policies and choices in the future. And if we see those gaps close, we know that we're doing our job. We're accomplishing our goals, because it's to the uplift of those that would otherwise get left out.
Perfect. So, first of all, I appreciate you entertaining all these questions. I hope the folks have had a chance to gain a better understanding of what Parkview Legacy Foundation is all about, and had a chance to meet two of its amazing leaders. That being said, and no is a perfectly acceptable answer, by the way, is there a compelling question that I did not ask you that I should have? I'm going to
I
take that
don't
as
think so.
no.
I'm gonna say no. But Sherry,
No, I think we had a pretty robust conversation, and I can't think of anything on the top of my head.
Excellent. Okay, so here's what I'm going to do. I'm going to go ahead and make sure that in the description of the interview and the video itself, folks have all the contact information for those folks that have $15,000 burning a hole in their pocket and looking to make a positive impact on the community that they call home. I want them to be able to have the contact information to make those connections and begin to have those conversations. And I just want to say thank you both very much for spending the time with us today. I look forward to what the future holds for Parkview Legacy Foundation, and may that 10 or 15-year vision become reality for us all. Thank you so much.
Thank
thank
you,
you.
Norm.
Appreciate it.